Do you ever find yourself feeling constantly tired, struggling with energy, or just not quite yourself, even when you think you are eating well? Sometimes, these subtle signals are your body's way of asking for a closer look. It can be easy to dismiss fatigue as just part of a busy life, but it is worth exploring if something more is going on beneath the surface. Yes, if you have iron deficiency anemia and the cause is not clear, it definitely can be a red flag. This condition means your body does not have enough healthy red blood cells due to insufficient iron. While often treatable with iron supplements, when the reason for the low iron is not obvious, it can signal an underlying health issue that needs attention. The why behind iron deficiency anemia is crucial because iron is essential for producing hemoglobin, which carries oxygen in your blood. Without enough iron, your body cannot transport oxygen effectively, leading to symptoms like fatigue, weakness, and shortness of breath. When doctors cannot pinpoint a common cause, such as heavy menstrual bleeding or a known dietary iron deficiency, they look deeper. This is because unexplained iron loss can sometimes be a sign of internal bleeding within the digestive tract, potentially from conditions like ulcers, polyps, or, in some cases, certain types of cancer. It is your body's way of signaling a silent issue. So, what can you do if you or someone you know receives this diagnosis? The first and most important step is to work closely with your doctor. They will likely recommend further investigations to uncover the root cause. This might involve blood tests to check iron levels and other markers more thoroughly. Your doctor might also suggest imaging studies or endoscopic procedures, such as an upper endoscopy or a colonoscopy. These tests allow doctors to visualize the lining of your digestive system and identify any sources of bleeding or other abnormalities that might be contributing to the iron loss. An important distinction to understand is the difference between dietary iron deficiency and iron loss from internal bleeding. For example, some people with celiac disease, an autoimmune condition where eating gluten damages the small intestine, can struggle with iron absorption, leading to anemia. Another lesser-known fact is that even prolonged use of certain over-the-counter pain relievers can sometimes lead to subtle blood loss in the stomach, which over time can cause iron deficiency anemia. Understanding the precise mechanism helps guide the most effective treatment plan, moving beyond just iron supplementation to address the core problem. Ultimately, an unexplained iron deficiency anemia diagnosis should be seen as an opportunity to gain valuable insights into your overall health. It is a prompt for you and your healthcare provider to investigate thoroughly, identify any hidden issues, and address them proactively. By understanding the why and taking the right steps, you can restore your iron levels and, more importantly, safeguard your long-term well-being. Always consult with a healthcare professional for a diagnosis and personalized medical advice.